Is my thyroid nodule benign or malignant after biopsy? When you find out you have a thyroid nodule, it's natural to wonder if it is benign or malignant after a biopsy. The most common method to determine this is through a fine needle aspiration biopsy, often guided by ultrasound. This procedure involves using a thin needle to collect cells from the nodule, which are then examined under a microscope for any signs of cancer. Fine needle aspiration biopsy is considered a reliable tool for evaluating thyroid nodules. Research shows that it has a sensitivity of about 86 to 89%. This means it correctly identifies malignant nodules in that percentage of cases. The specificity, which refers to its ability to correctly identify benign nodules, ranges from 71 to 92%. However, the accuracy can vary based on the size of the nodule. For nodules larger than 3 to 4 centimeters, the accuracy decreases, and the false negative rate can be as high as 30%. This means that larger nodules may need more careful evaluation. The results from a fine needle aspiration biopsy are often reported using the Bethesda System for Reporting Thyroid Cytopathology. This system categorizes findings from benign to malignant and includes categories for indeterminate results that may require further investigation. While fine needle aspiration biopsy is generally reliable, it does have limitations. There can be false negatives, especially in larger nodules or those with cystic components. This means that a benign biopsy result does not completely rule out the possibility of cancer. If the results are inconclusive or suspicious, additional tests such as a core needle biopsy or molecular testing might be recommended. Core needle biopsy can reduce non-diagnostic results and may have higher sensitivity than fine needle aspiration biopsy, although both methods have similar specificity. The ultrasound features of the nodule and the clinical context are also crucial for interpreting biopsy results accurately. Nodules with suspicious characteristics on ultrasound may require surgical intervention, even if the fine needle aspiration biopsy indicates a benign result. After a fine needle aspiration biopsy, if the result shows a benign nodule, the risk of cancer is low. In such cases, patients are usually monitored with periodic ultrasound and clinical follow-up. If the biopsy indicates malignancy, surgery is typically the next step. For indeterminate or suspicious results, further evaluation with repeat biopsy, molecular testing, or diagnostic surgery may be necessary. Ultimately, decisions regarding management should be personalized. Factors such as nodule size, ultrasound features, patient risk factors, and individual preferences play a significant role. In summary, while fine needle aspiration biopsy is a widely used and reliable test for distinguishing between benign and malignant thyroid nodules, it is not infallible. A benign result usually suggests a low risk of cancer, but ongoing clinical judgment and follow-up are essential for accurate diagnosis and appropriate management. Always consult with your healthcare professional for personalized advice and guidance.